Thank you so much, sir.
Good evening, good afternoon, and good morning. This is the 1860th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Rahul Jadhav. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends, whether it be a homeopathic lover, a homeopathic doctor, a student, whatever may be. The purpose of the forum is to take homeopathy to every home around the world. We are proud to say that we have uploaded more than 4,000 videos in our YouTube. Those who want to watch the previous videos, you just visit IFPH Homeopathy at YouTube. You can search and find the videos there. Very recently, just last Sunday, we celebrated our 5th anniversary with a brilliance from participants all over the world. And we have international participants from doctors around the world, as well as from India. And there were different sessions discussed. We have discussed about the veterinary homeopathy, dental homeopathy, as well as agro-homeopathy and homeopathy in autism, homeopathy in cancer. Like so many sessions were done, and it was really a brilliant day, and hope all of you can watch it in the YouTube in the coming days. We will be uploading the same also. And as you all know, today's guest is none other than Dr. Rahul Jadhav. He has completed MD and has presented the first session last week, some 3 days back, and that was a brilliant session. And today, Doctor will be continuing the second part of the same case with the analysis and his scope and how he has managed. All those things will be discussed. And he is a practicing classical homeopath with a clinic in Satara, Karif, and Pune. Along with the global online consultation, he has presented well-documented clinical cases at various homeopathic medical colleges and national and international seminars, along with his wife, Dr. Thanusri Jadhav, conduct the monthly webinar on classical case studies with Dr. Rahul and Thanusri, where more than 50 inspiring cases have been already shared to the community. His work is known for practice, the precise remedy selection, expertise in use of well-known medicines, and evidence-based documented case studies. He has more than 60 years of clinical experience. That is a very good thing, because most of the doctors are struggling to get into that way, but he has done an excellent job in promoting homeopathy, as well as curing a lot of patients with the classical homeopathic practice. That is, there is nothing called a classical or whatever maybe, but it is what Dr. Salman Hanu has suggested what is homeopathy. That is what some people call it as a classical, but there is nothing like called classical or Western. And today, last day, Doctor has presented a case of hepatocellular carcinoma with liver cirrhosis. And today we can hear what Rahul doctor has to say more about that. We welcome you to this session. Yes, doctor, welcome. Yes, now you are co-host, and now you can share the screen and everything. And then you can unmute yourself and you can speak. Please unmute. You're still muted.
Can you hear me now?
Yes, yes.
Okay. First of all, thank you so much, Dr. Dhanesh sir, once again for allowing me on this wonderful platform that is giving selfless work for the homeopathy. First of all, uh, on this Sunday, now we have so many active participants. That's very really beautiful to see that in spite of holidays, the people are sparing time to learn, grow, and share. And I think this is the motto of this platform, to share and grow together. So, starting my sessions once again, I would like to emphasize one point. You, sir, very rightly said that there is nothing like contemporary, classical, and Western homeopathy. In 1796, when this science was started, now 1796 to 1896 to 1996 is more than 200 years now. It has not, it has spread to so many countries. So many people have benefited. This is not due to the single method. This was possible only because multiple homeopaths applied multiple ways of reaching to the remedy, be it pathological, be it through the mind, be it through the some keynotes. So it is like the art part of this wonderful pathy, that you can choose your path and ultimately reach to that indicated remedy, and then everyone gets benefited. So I fully agree with you, sir. Uh, Now let's start my session. And I can see, sir, there are some people who were not there last session. So I will get made some quick revision about the case background, and then I will move forward. So here I'm starting the session.
Yes.
So just let me know. Can you see
Yes,
my?
yes. Everything fine. You can go ahead.
Okay. So recently, and now I am using this Indian Zoho for PPT. So that's why I'm asking, and I found it very interesting. Previously it was PowerPoint, WPS, but I think this gentleman from Andhra has making a lot of news recently. He's from Indian person and started such a beautiful setup which is spreading the world. So this is by the use of this PPT is made by using Zoho. So it was a case of hepatocellular carcinoma. Okay. The reason actually why I choose this case is, as Dr. Dhanesh sir in the introduction told that I have, we have this WhatsApp group, like around 500 student, similar to your group, that where we non-commercially share the cases, discuss the cases. I'll tell about this group in the last part. But I heard that there is a lot of discussion about, genuineness, authenticity of this science. There are people are skeptical, especially some kidney doctor, some so-called liver doctor that is coming from the same state, who is continuously raising the pointer about this science of homeopathy. I thought that this case, in future, if we got some platform, I think this case will be very much example for such a skeptics of homeopathy. Because what I tried to do here is not only solving the case, not only reaching the remedy, but a entire well documentation, like before, after, its reports, patients video testimonials. So this all package is not just to show that yes, I am curing this patient, no, but to make, to underline the authenticity of this science, especially for those who is unnecessarily keep on criticizing and spreading lies, spewing venom, actually toxicity about the science. And that's why many people remain unbenefited due to this false propaganda. So I think this case will be beneficial for those so-called liver doctor also. I think few of you can identify to whom I am pointing about, especially those who are from Kerala. So this case was about 52 years old woman who was diagnosed with hepatocellular carcinoma on the background of cirrhosis. So she already has cirrhosis, portal hypertension, splenomegaly, pulmonary cox suspected, and finally hepatocellular carcinoma. So now I'll tell you a few things about this hepatocellular carcinoma. I'm pausing my PPT for a while because so that I can talk face to face. Just a minute. Okay, so about liver cancer, I'll speak few things about liver cancer which I haven't spoke earlier. See, this liver cancer is a little bit strange thing. They are asymptomatic for a long period, almost until the 70% of liver, unless and until the 70% of liver you don't get damaged, they don't produce severe symptom. Number one. Number two, conventional chemotherapy has very little scope. You know, I have a YouTube video of a renowned liver surgeon from Pune, not from that Kerala one, from Pune. So he has beautifully told that how the chemotherapy has very little scope in this liver cancer. The number one is removal of the part. Number two, liver transplant. And number three, they ablate the arteries and veins supplying that tumor. So these are the three modalities. Now, if these three modalities are not working, they are just left to some trial and error kind of chemotherapy. I'll tell about this. Screen is not showing. Yes, I have stopped the screen, but can't you see my face in the first?
Yes, everything fine except the screen because we know that you are sharing it as and when it is necessary. That's the reason why the screen is
I
moving.
thought that just face-to-face comparison
Yes,
for
yes, yes. That's
conversation.
good.
And
That's
then
good.
go to because these are things to be discussed, sir. I went to Belgium last 10th April at Sheikh College, and just I'm sharing my experience. And there are students who recently saw that video. The person I'm talking about, this is so toxic and you know. Devaluating, that they were little bit discouraged. Okay, that homeopathy is all alcohol and all, and they make news channel. So that's why I thought that we should talk on this topic also. See, homeopathy is a science which is just I have told you that it is not something that is we discovered in Maharashtra or you discovered in Kerala. It is way back started in 1796 in Germany. Then it spread to the world. So it spread organically. You know, there was no such advertisement, and it is from people keep on getting benefited from days, from months, from years, from generation to generation, and then this science has grown. So you as a student of homeopathy should never get discouraged by such a allegations on homeopathy. You must remember that our Dr. Constantine Herring, everybody must be knowing the story of Dr. Constantine. He was assigned a task to write a book defaming the homeopathy, criticizing the homeopathy. And at that moment, he started studying homeopathy. Our legend, Dr. Constantine Herring, who has written Herring's Guiding Symptom, who has done lachases of proving. And one more thing I would like to tell about Dr. Constantine Herring, the Allen keynote which he used. I remember when I was in fourth year, and we had a seminar of Dr. Prem Kumar from Hyderabad, I think, and he has asked this question: why Allen keynote is so important? So 2 minutes, 5 minutes, 10 minutes, everybody was trying to answer, but nobody could answer it correctly. His question was, why Allen keynote is so important? What is the importance of this Allen keynote? I was fortunate to give the answer which he said that is right. So Allen keynote, you can write in chat box if anyone knows why Allen keynote is so important. Okay, we have less time. So why Allen keynote is so important? Because it is an exact notes of Herring Guiding Symptom, which is our source book. So the point I'm telling to you was Herring was assigned task to criticize the homeopathy, write the book against homeopathy, and he was ended into a greatest homeopath ever. So whoever gives a true trial to this science, give a true, with an open mind, definitely he will become a follower, lover, and propagator of homeopathy. So coming back to this case, I was talking that this liver cancer has very limited, treatment modalities available in modern science. I'll go to my presentation again. Yes. So it is about this lady, 52-year-old. Now, so how I analyze this case? Okay. So from my perspective, there are something that we just can't afford to miss, that is cancerous affection and liver affinity. These are the physical symptoms. So in our WhatsApp group, I have shared the original case record. I have shown that in the last section. If you have missed this, please watch. Original, our student has taken this case. So this so-called miraculous, I will not use the word miracle, but this case has shown very promising response, very quick and amazing response. Now this is not possible just by us quick tips and tricks. What we are doing is something which is very scientific, as per the guidelines we received as a in our medical education, homeopathic education. So after 20, 30, 45 minutes of information gathering, these are the physical PQRS what I found. There was cough, there was fullness after eating, which is typically a symptom of liver disease. There is headache, bilious, and right leg numbness. Okay. Oncologist report, this is also I shared you. Just I am repeating for those who has missed the session. In a brief, like 10 minutes, I will go through and then I'll go to the second part of this session. So now the interesting thing was liver is small, shrunken in size, and clear-cut liver cirrhosis. So this liver cirrhosis is not just in one report, but 2, 3, 4 consecutive reports. See, in this report also, this is way back in 2018. Again, liver is small size with corticotexture, irregularity, cirrhosis, spleen is enlarged, then gallbladder is thickened, all kind of portohepatic system, what we say, is severely compromised, that we can clearly see in the reports after 2020, 23, 24. Now, the concern that took patient to homeopathy is liver cancer, a tumor in the liver. But try to understand that this liver cancer or the tumor in liver is most common in liver cirrhosis cases. Okay, this is a documented. This is what you can also see in the in the literature, modern medicine literature. Okay. Now, histopathology report is also in front of you, that patient scam. Now this is what I want to tell you. See, I know this is a homeopathic lecture. Many of you might object that, we are discussing homeopathy, matra medica, something, but why we are in between showing this clinical part. But my dear friends, nowadays it is very important that you should be sound clinically. That is for two reasons. First of all, we are living in this environment where it is a truth that we should accept that modern medicine is still a dominant system of medicine. Even we and our family member has to sort for that. There is nothing wrong in that. Now when we have to communicate with them, when we have to tell them that this science is working, it has result, then we should know what are the clinical part also. Now, as you can see, this is a criteria that is called as Milan's criteria when it is related with the tumor size. So if it is less than 5 centimeter, okay, then if it is single less than 5 centimeter, then you can see transplant is a gold standard. Okay. Then it is intermediate, multiple or larger than 5 centimeter. Then transarterial chemoembolism. Simply they embolize the supplying artery to that tumor. So they are stopping the nutrition of that tumor. Okay. They are not removing because it is too big. In this case, it was not 5 centimeter, not 6 centimeter, not 7, it is more than 9 centimeter. So this is an ideal case for the alternative treatment, not just from the some kind of faith or somebody suggesting that you take homeopathy. Modern medicine, this is a really areas. We know there are many areas where modern medicine is really has little or no scope, like we see n number of autoimmune disease nowadays, ranging from rheumatoid arthritis to ankylosing spondylosis to simple thyroid. Yes, the patient thyroid, which is way around us, 80-90% of them are nothing but autoimmune, that is Hashimoto's thyroiditis. So this autoimmune all range, it is an domain, or the main area where homeopathy is really at an upper age. So in this case also, because it was more than 9 centimeters, because there was huge splenomegaly, because there was portal venous portal hypertension, and because it all impacting the patient's symptoms, it was producing symptoms also like fullness, sleepiness. This was needing some alternative treatment or wait and watch. Okay. Now here I have started with pathological rubric. So now I will not ask you symptoms like last time we have discussion that what rubrics you feel, but here I will only summarize. Okay. So the first and foremost rubric that I have considered in this case here is simple pathological rubric. Okay. That is, see, patient has come with a bunch of reports. Okay. So many bunch of reports. Now we just can't say that we are homeopath and we are not going to see your reports, not like that. Even I'll say that at least you should derive some pathological conclusion in this from these reports. Okay. So the plain simple rubric that we have considered is cancer affection. No, directly we are not going to give this one remedy from this, but we are going to consider it. Dr. Sadia Sayed is what is BLBCLC stage. So as far as I know, you are asking about this Barcelona clinic liver staging system, right? Yes. So yes, it is a widely used system. Okay. They have not as such typically classified. Okay. Now here, as far as I know, this Barcelona system has early, intermediate, advanced, right? So definitely it will not be early, because for early they are less than 3 centimeter. Either it is an intermediate or advanced only, because in intermediate it is a we can say big size, multinodular. Here it was 2 nodules. So you can say intermediate to advanced, not early and very early. Okay. I hope you have got your answer, Dr. Sadia. Moving on to the further, we have discussed something about pathological rubric. We should not jump directly to the cirrhosis. We can take cirrhosis, but at least we should know the difference between cirrhosis, atrophy, hard intolerant, hypertrophic liver. So difference is that cirrhosis is a diagnosed condition, scarred. So we have very small group of remedies in that. As far as the atrophy is concerned, it is end result of cirrhosis. Okay. If the cirrhosis is prolonged, it has become shrunken, destroyed, and then only we label it as a cirrhosis. Okay, sorry for interruption. And hardness, distension of liver is just enlarged liver. Nowadays, we can see, you say epidemic of fatty liver. Every other person, those who are sitting, more than 50 are there, very good. So if you go to our USG also, many of you, I'll bet you that 10 to 15, like 20 to 25% of us might have this fatty liver. It is just a kind of non-alcoholic fatty liver. Okay. And this is just part of big belly, that is due to the sedentary habit and due to our carbohydrate intake. India ranks very higher. We can talk about that someday later. So here, that is also a enlarged liver. So the right rubric here is atrophy, because in multiple report we can definitely find that it is cirrhotic, shrunken, and all. So repertory often places more remedies here because atrophy is a deeper final expression of disease. It reflects chronic destruction pathology and many polygress antisoric we have. So right now in front of you, you can see the same rubric from the section liver, abdomen, atrophy liver. And again, more importantly, the cross reference given is, just a minute. Cross reference given is cirrhosis of liver. Moving on to the further, we should also know, see, if the patient is coming to you with a bunch of report and cirrhosis, this should be in your back of the mind that she might have ascites, she might have jaundice, there may be portal varices, portal hypertension, bleeding esophageal varices, spleen enlargement, dropsy. Now this every condition has common uncommon rubric. So before we begin to the actually individualization in the form of desire aversion, that is a physiological part, in the form of mind, we should know that this is a localization, exactly what Dr. Boger sir talks about, Dr. Boning Hussain talks about, the location, the seat. Now we can blindly prescribe on that alone. That is one extreme. I'm not talking about that. Just start a patient coming with liver complaint and you start the chilidonium Q. Yes, you can do that also. As I have already told you that there is nothing classical like that. We have limited time. You have some, patient is far from you. These are some excuses basically that you can prescribe pathologically. But as far as the sincere follower of Hahnemann, ardent follow-up Hahnemann, we should make every effort to individualize the case. It need not to be 1 hour long case taking every time. No, you can individualize even one word, one sentence, one keynote, one expression also. But our efforts, we should not, do some shortcuts. So this is about some uncommon symptoms of this case. Somebody is in chat box. In the chat box, let me know, are you all with me? You're understanding the case? Type yes, no, so that it should not be monotonous. Okay. Yes, very good. So this is just revision, but it's worth revising because this case is really interesting. I'm not saying this case is mine, so that you should clap and appreciate it, but it is a beauty of homeopathy. Something that happened with this lady is what I will, as a homeopath, remember throughout my life. The reaction, the follow-up of this lady, the reaction of radiologist, the call radiologist made to me and asking, where is cirrhosis? It's simply that brings a goosebumps to the homeopath. And these are the moments for which we leave practice homeopathy, isn't it? No, it is not possible in every case, but yes, whenever it is possible, we just bow our head to Dr. Samuel Hahnemann and this wonderful science. Okay. Now about the analysis of mind, as I have written in this case also, that she is a fearless, hardworking woman. Her entire life revolves around farming. Okay, that most of her time and energy spent in the field here, as her mild and submissive husband cannot share workload. She carries her family responsibility with dedication and remains troubled by her son's divorce. That was her mind. Now, naturally, she was Naturally, she was very punctual, disciplined, strong, insistence on completing work on time. The farm work is delayed. She quickly become angry and scolding both. So her more focus on farm work, and she has taken responsibility of her family. Now, conflict with mother-in-law, again there is anger outburst, insult, mortification. And she attempted a self-harm when she was got accused, put down, insulted by her mother-in-law. In short, her personality is strength, responsibility, and fearlessness. Now, this is the conclusion that I have drawn after 30 to 40 minutes of discussion. I have earlier shared the original case record also. How patient tells this, how we ask to patient's son. This is all different part, that is case taking part. But here, why we are here is just to summarize this thing. So the things that I have taken is industriousness, mortification elements from anger at trifles, anger when things are refused, impetuous means sudden burst of anger, anxiety business about an suicidal disposition. Yes, suicidal disposition. Now, also physical symptoms. She has headache, a bilious headache, bad bilious headache. So it is after becoming cold. Head pains are actually after sun heat. Now cough, sleep during, especially during sleep, she used to cough a lot since years, not months, years. Head pain, which is better by vomiting, cough, suffocating cough, thirst at night. She has a right leg pain and right leg affection earlier, and diarrhea morning. In our WhatsApp group, so we have a WhatsApp group where we discuss case. Uh, Many have tried to answer this case. Most answers were arsenic, phosphorus. So here I would like to show you, as I've already told you that I am not here to just show you before and after result, but to take you to the process. Okay. Now I am again taking you to one interesting part, that how we discuss the cases. I know many of us are doing the same thing, but to just to tell you, so I'm sharing my screen now, and what you can see here is our WhatsApp group. Okay. So here you can see, after posting this case, these are the reply that our, see, this is a case. Can you see?
Yes.
No, classical case. Now this is the first page. So we give well documented case beforehand. Like in the discussion, they usually come prepared. So 1, 2, 3, 4 chief complaints, then what is in her mind, and what is the follow-up and all. Okay. Not only this. So we share this also before reports and after report. Now the wonderful thing that happened with this lady is that this sentence, okay, this sentence what surprised the radiologist: liver normal in size with slightly altered ecostructure, and previously it was small, shrunken, diffused, all symptoms of cirrhosis. You can see initially spleen was 17 centimeter. Spleen was 17 centimeter, where now it is reduced just 12.3. Again, there are many changes even in portal vein, hypertension and all. Okay, so we also share this. And when we ask this artificial intelligence this about this result, so this was the response, that in standard medical experience, such a reversal in 5 months is extremely rare, particularly without conventional intervention like antiviral, surgery, or transplant. Most improvement in cirrhosis are gradual and partial, and full functional recovery is dramatic. Okay. So yes, in practical term, this can be considered as a clinical miracle. These are not my words, clinical miracle, especially when correlated with patient's overall improvement. Yes, because patient was improved overall also. Okay. So this is also what we shared in group. And then see, Dr. Zahir Sheikh. So he has put his own analysis. So everybody is applying their analyzing skill. Dr. Suvarna Wage, she is our very senior and sincere student practicing in Mumbai. Dr. Suvarna, are you here? I think she is not attending. Anyway, Dr. Harshal Kadam sir. So everybody started to analyze this case, and that we are doing since last 40 cases. So after that, we take a poll. Okay. Now these are the original case records. If you want to see, these are thermals that we have taken. This is the headache. You can see every modality of headache, vomiting. See, if we want miracle, then we should put efforts also in that sense. Every symptom was probed. This is an original, unedited, raw case record that is from my clinic, and that is the way in which we approach. That is the way which we learned from Dr. Amar Senikam sir, basically. Okay. Now this is again analysis by one of our team members, and many times they crack the remedy rightly. Okay, you can see this is a senior doctor from Karnataka. He has again taken very right rubric. And finally, we do one poll. that I would like to show you. Yes, you can see here, this is a poll. These are the remedies. So this is the entire scientific process that everybody puts their efforts, and once you put your efforts to crack the case, that neuronal circuit that forms in your brain, that hustle that you do to crack the case, to solve the puzzle, and finally that, I think that process is something which remains with you forever. Okay, so just I want to show you this because this is the efforts that we are doing. Coming back to the presentation, so these are uncommon symptoms that is taken from this detailed case. Thermal state. Now here, now we are coming to the second part. In the last part already I have talked about this. Many of you has reached to arsenic in this case. Arsenic, phosphorus, then there was tuberculinum and all. Yes, that might be required in the later stages. This patient, I am no way saying that it is cured, but whatever we have achieved, symptom wise, lab investigation wise, and ultrasound sonography wise, in every area there is significant improvement, and that is through this uncommon symptoms. So the patient said that whenever there is cold, she become very cold, she start headache. Now many has mistaken this for a chilly symptom. Even hot patient can have headache from becoming cold. That's what I want to say, and here are some rubrics that I have told you that after giving few months of treatment, this is a miracle. Also, I talked with these ladies last week also, yesterday also. I'm in continuous communication. Still, there is no symptomatic recurrence. Okay. This is the most important slide of the session. I have told last time also, those who have missed, for them, I am repeating. This is a way in which we are approaching. We are not following a fixed protocol. We are not following some therapeutic byways. What we are doing is a beautiful balancing of pathophysiology and mind. So basically there are three S, three P's. Okay. One is pathology, one is physiology, and third is psychology. So in every case, we try to find a beautiful balance of these three to reaching at the remedy. Yes, I fully accept that it is not possible in each and every case to take proper mentals, to take proper physical, to proper pathology, but it is not impossible also, isn't it? So as an ardent follower of Dr. Samuel Hahnemann, as I already told you, at least we should do our best effort to take whatever information possible. If it is not possible, then it is well and good. Well, not well and good. We have to go as it is if it is not possible. We can individualize one symptom also. I know there are master prescribers who just see few reports and then also they can prescribe. But again, during the process of learning, we should learn properly. And then if the part is missing, then also we can proceed. If you are learning to drive, for example, then how you learn? You don't go to the highway directly. You go to some quiet place, a ground where a tutor sits near you. Then slowly you learn how to brake it, how to handle the steering, how to put a brake, how to accelerator. Many times you fail, and then the time comes when you smoothly drive. Sometimes you comb your hair, look into the mirror. You should not do, but sometimes you take your call also, mobile call. So this comes with the practice. Sometimes you can drive the car which is not in good condition, which has loose brakes, which has not service for years. And so in the similar way, cracking the case, first start with the classical, instead of classical word, I will use the academic method, what we learn typically in our colleges. And then as you progress, the intuition is not overnight thing. We see some master prescriber patient comes and sits in front of you and they said, yes, this is Naxomica, give Naxomica. This is also possible. But this is possible after months and years of sincere efforts. And then our brain has, they made some neuronal circuits. I used this word earlier also. This is to the practice only. So this slide is important because this is the way in which I approach this case. And the remedy was given was just Bryonia 30. Okay, Bryonia 30 was the remedy, and this is the analysis, some physical symptom, mind symptom. This is all in the last video you can see. I'll post on our WhatsApp group also. Now, coming to the next part. Now, this is a stomach rubric that is interesting. Many of you has told me after this last session, we do accept it is a bryonia from other point, but suicidal disposition is not so much marked in bryonia. This is very interesting. Now I will close this PPT and just we will do some face-to-face communication. So I am fortunate. Are you all with me, or it is one way?
Right.
Yes, yes. So I was fortunate to get trained with the legendary Dr. Amarsi Nikam sir from Pune, who runs 100-bedded hospital. He had been to this platform. Dr. Dhanesh, respected Dr. Dhanesh sir, has given opportunity to our members like Dr. Mukesh and Amarsi Nikam sir. So he has very beautiful book, a name Homeopathic Hospital. Yes. So as I have shown you one case, which is can be considered as a clinical miracle. There are 30 such cases, 30 cases in that book. The name of the book I'm typing in the chat box. Name of the book is, many of you might have read this book also, The Homeopathic Hospital. Yes, this is the name of the book. Okay. Now, why I'm referring to this right now? Because there is one case in that book. It is a case of porphyria. Anybody know knows this condition? Porphyria. Anyone? If you know this, or if you know something about this pathology, please let's make it two-way.
Those who want to answer, please raise.
Yes.
Okay, you can communicate through messages.
So yes. So it is an acute porphyria kind of disease. And what happens? It is very painful condition. Very painful. So it is actually a group of metabolic disorder caused by defect in heme biosynthesis pathway, and patient literally screams. Okay. Now I remember this case. This is given in the book also. I highly recommend. I highly recommend to read that beautiful book. Beautiful book. And in that, the patient came to Dr. Nikam sir's hospital, and he was having very bad abdominal pain, unbearable bad abdominal. And if you are acquainted with Dr. Nikam sir's methodology, so he runs an 100-bedded hospital today. Also, it is running very smoothly last 25 years with this method, which I just told you, like classical single remedy, minimum dose, and all. So this patient came to Dr. Nikam sir, and he was having very bad abdominal pain. And there were, of course, other symptoms also. Student has taken the case. And the one peculiar symptom was that during this painful state, he was saying that I don't want to live now. I want to die. Please give me poison. Okay. Now, this symptom that want to die during abdominal pain, it is a mental characteristic symptom. And the only remedy given, only remedy given in the radar and complete repertory basically. So Dr. Nikam sir prefers complete repertory. Okay. So you can see, can you see my PPT? Dhanesh sir, can you see my PPT? Hello? Yes, okay. So,
yes.
Okay, yeah. So you can see the symptoms that you should also remember. Gastralgia, in the bracket, cardialgia, gastroenteralgia, neuralgia, with inclination to commit suicide. Again, this is from the beautiful hearing guiding symptom. So with this symptom, patient was within minutes relieved with that acute porphyria pain, very severe pain. You please refer to this case. Okay, then there is some reference from Vithalkos I gathered. It seems to me that insecurity rises from a lack of social contact in bryonia patients. They do not allow themselves. So now I'm talking about bryonia. Last next part of this session, 15 to 20 minutes, I will talk only about bryonia. Okay, bryonia is a day-to-day remedy. I know many of you have literally used hundreds and thousands times. Okay, but still I found it worth describing, because in Indian setup, we are developing country, a middle class, huge middle class. I will stop this PPT for a while and we will connect. We will talk face to face. Okay. So in India, which is a developing country, which is we have a huge middle class, this bryonia personality is quite common. Bryonia is something which is concerned with business, work, task, duty. So we have Kali group also. So we have Naksumika also. Then there is a differentiation and all that we will talk about. But just remember, bryonia is not a rare. We call platina rare personality. Then we have again vanadium and rarest of rare. Nowadays there is so many. If you open the social media, most of the time, unfortunately, there is a lot of talks about rare remedy, and many youngsters developed FOMO. FOMO, that, oh, I don't know this remedy, rarest. But let me make it very clear that our well-proved polycrest are many times more than sufficient to tackle most of the cases in our practice. This is a fact. This is not only my experience. If you go to the many senior homeopaths, like right from this all Calcutta legends, and this from Kerala, we see there are many, and of course the Bombay school, the Sankaran sir, Vijay sir. So Sankran sir means P. Sankran, then Rajan Sankran sir went ahead. But if you see Rajan Sankran sir's again latest approach, then they are again coming to the basics. So what I want to tell you, that this mastering polycrest is very important instead of running to rarest and rare remedy and newer combination. So we feel that, oh, we have attended some new seminar with some new things, but what requires is a mastery over the well-known remedies. This is bread butter, morning, afternoon, evening, that we see these remedies, and this kept on working for decades and centuries, not only now. Okay, so that's why understanding bryonia is very important. Now, bryonia is a patient who is concerned with his daily insecurities in terms of money. Now this is a anxiety business, about talks about business. So now there is a beautiful school of homeopathy which focus only on the mind. I have not much to say about that. Okay, they are doing a very good job. We should learn from that also. But personally, I am not using only mind method. That is a fact. I am neither against them nor with them, and I'm not also political about telling that. I'm telling what is I'm doing. But you can learn using this plain rubrics, which might we many times miss, but they have. I'm talking about the so-called mind method group. That is lot of talk about that in right now in homeopathy, and they have done good job to taking homeopathy to the grassroots. But again, here I want to tell you the same which I have told you two times in this lecture, that homeopathy has grown not due to the mind method in this 200 years. Please try to understand. This is an additional weapon that now we have in our armarium. This is not with which homeopathy has started, right? Homeopathy has started, if you, there is a mention about bryonia crude dose in Organon, if I am not wrong. Anybody can correct me in the chat box. Dr. Simon and Hanuman has used crude dose of bryonia in a case and it worked wonderfully. So this bryonia is coming from that heritage, and we just can't afford to can't afford to miss to learn this bryonia remedy. Okay, so I was telling about the mind method, and I was telling about the mental state of this bryonia patient. Okay, so this bryonia patient is someone who is, of course, very irritable. There is a rubric that delirium wants to go home. Everybody know this. Okay, in cases of fever, I remember a small child is coming with her mother, a bad fever, dry lips, very irritable, cranky. And during my entire case taking, he was saying, Mama, ghari chala in Marathi, just take me home, take me home. And of course, he was having all fever. He was having to the local general practitioner for 1 week, and fever was not responding. Considering the fever symptoms and considering this peculiar mental symptom together, that I'm again telling you, together, I have given Bryonia 13. It worked wonderfully. There was another lady which we discussed in our WhatsApp group that she was having huge right eye swelling and painful condition. He has been to the ophthalmologist, and during consultation, so she first went to my wife's clinic because she was living nearby, and my wife has taken beautiful, video consultation of that patient. If time permits, we will show you later sometime. So she was having very severe right sided swelling in the eyes, and all kind of ophthalmology drops also she was taking but not relieved. There was stitching pains, there was some discharges. And what she was telling my wife, please include her mother's consultation also in her own consultation fees. Okay. So she was having pains, and her demand was about the bargaining. So one of the interesting rubric of this Bryonia patient is bargaining. So there are many bargaining patient in our clinic. Pulsatile is also excellent bargaining, like smiling, laughing very softly. She will, make you mold to give many. But Bryonia is the greatest bargainer of all time. If I remember last 10 years, there were 2 to 3 patients whom I sent medicine by courier, but they didn't give me money. And that was the Bryonia case. I clearly remember. And even she had sent patient to me, but till now she hasn't given me money. So bargaining is something related to money and all, and Bryony has very strong inclination to simply because he was very insecure about money. He feels that I might get poor, so fear of poverty. So there are 2 remedies. Compare here, Bryonia and Calcarea fluor. Okay, these are very close. And Bryonia, Calcarea, because they are having Calcarea component, they are even very fearful of taking risk. So there is differentiation, but they both have this fear of poverty. Please remember. Okay. Now, next point about this Bryonia patient that you should not miss is aggravation from being disturbed. They don't like to be talked, want to still in bed, no movement. Very great irritability. If you ask for something, they will just burst on you. If you ask too many questions, so there is a beautiful rubric: anger when obliged to answer. Okay, this you should remember. There are many remedies in this. What I can quickly remember, I will type. Bryonia is there, Natramur is there. Participant, you can also contribute. This is very important expression. Many times we get day to day. Anger when obliged to answer. There is colocynth. Anything else you want to add? Of course, Naxomica. How you can miss Naxomica? And even Gelsem is also there. Okay, we can straight away open the radar here, and I'll show. This is important rubric that you should not miss. Are you all with me? Understanding the session? Very good. Anger when obliged Yes, arsenic and phosphorus is also there. Dr. Devashri, Dr. Sadia, right? Very good. So
Yes,
now wait away.
it's Dr. only 3 minutes remaining.
Yes, sir.
And if we want, we can have another session because because
Yes, yes.
it is not yet
And this
complete.
discipline is very important. I fully understand. Just take a glance at this rubric. I think you can see. Okay, and I will pause it here and again go to the. Okay, I will again finally go to the presentation. So this is a difference between arsenic and bryonia. Okay, that you can also see arsenic and bryonia. Arsenic is fearful, bryonia is not fearful. Even bryonia talks about it. This is point-wise difference. Now, second part, I have collected many things: clinical condition, constitution. This is academic. You can take, you can learn from yourself also. And just remember, Bryonia is not always thirsty. Right now, I'm showing mouth dryness without thirst. This is from the Kent. In without thirst also, Bryonia is mentioned. So if the patient is not having thirst, don't rule out, please. Okay. Then last thing I want to tell in just 1 minute is about this discussion group. We have more than 563 members where we discuss these cases. So this is a Takayasu arteritis, very interesting gross pathological case that we have discussed in June. So this is a way in which we discuss the case, and these are the notes. So at the end of every month, my wife, Dr. Dhanashree, present the beautifully conducted notes, and that is taken from all authentic source books. So if you have a question, you can just ask me on this. And here I will conclude section again with a lot of gratitude to Dr. Dhanesh sir and entire IFPH team. Thank you very much.
Yes, Dr. Jadhav, this is really an excellent session. You really covered everything about the case, because not only simply coming over a case and doing that this medicine is good for this particular disease, no. But this, why this bryonia was given to the patient, that's the more important thing. And how you come across the remedy, that also is a very important thing. Then another point you pointed out here is that better you always study the polycus in a better way. That is your bread and butter. Not that's really of course there are rare remedies that may need to be selected, but that in a different conditions. But in chronic disease and very in acute diseases, it is better to go ahead in that way. And as you rightly point out, bryonia is having no test also, just like dryness without test. Though people may think that, oh, it's a case of pulse cycler, but in the meantime, the pulse cycler has a similar symptom. They have no test, but it is thirsty also. And even if the patient take drinks, that patient used to take cold drinks. That it all depend upon the situation. Am I right, doctor? What's your opinion on that also?
Yeah, absolutely, absolutely. So this is a combination, and these are the polycrest that makes most of our practice. I fully agree with that.
Yes. Now, anyone from your group to say vote of thanks, we please ask someone to raise their hand, so that they can make a comment as well as vote of thanks. Because I don't know how many of them are there and who can speak also. Because actually we used to have our veteran Dr. Rambadesh sir, you can speak for a while, and then somebody from the group may raise your hand so that I shall.
Parshuram Patil sir, are you there?
Thank, thank you, Dr. Dhanesh ji. Congratulations,
Okay.
Dr. Rahul Jadhav sir. Very nice, excellent session. Classical homeopathy. Classical homeopathic is the best treatment of homeopathic. Single remedy, single dose at a time. And classical homeopathic is the gently, rapidly, and permanently cure the patient. है ना? तो liver cirrhosis wonderful case, and case taking and select remedy is the good. Very thank you. Behalf of IFPH, very thanks. Thank you. Again presentation. Thank you.
Thank you so much.
Who was the person ready from your group? Somebody could talk.
Yeah.
Please unmute.
Dr. Parshuram Patil sir, are you there?
Please raise name, please.
I think he's not there. Anyway, sir. Okay.
Is there anyone?
Okay. I think, sir, you have to continue next session also.
Okay, sir.
No problem. We have conveyed our message at our best and got such a wonderful feedback also.
From Saida Said. Saida Said, please, Saida Said. Can you say your experience in this presentation? Yes. Can you raise your hand so that you can speak also? Please raise your hand. Okay, please unmute. Please unmute. You can speak for a while. Yes.
Thank you, sir, for this session. I'm not a part of this group. I'm actually practicing predominantly on mind method and learning and integrating various methods, which I'm just going through. This is the first time I saw a case of hepatocellular carcinoma and liver cirrhosis. Actually, I'm assistant professor in Department of Physiology. So from applied physiology and whatever we had learned in college, we have often believed that cirrhosis is a grave pathological condition which is irreversible. Even in the modern medicine believes the same. But through this approach, I learned a new thing that, wow, like cases where allopathy is stopping is where homeopathy begins. Allopath will never have this faith that cirrhosis of liver is treatable and is reversible and we can treat hepatocellular carcinoma. But with homeopathy, we can do all these things. So it's amazing, amazing learning and excellent session. Thank you so much, sir. Thank you so much, team.
Dr. Said, please share your number so that I shall contact you for
Thank you so much, sir. Yes, sir. I'll put my name and contact details in the group. Thank you.
Okay. With that, before ending the session, let me say tomorrow we have a session from Dr. Praditha Rajendra Rathodia, and Doctor will be talking about general clinical examination and related rubric in Kent repertory. So another big day is awaiting for you to attend. So hope all of you will join us. Thank you once again, Dr. Rahul Jadhav and his team, and those who attend the session in this evening.
Yes.
Thank you all. Good night.